Okay, let's dive right in.
Hmm.
You sent us some really interesting material. We've got this CRISL research, but also insights directly from patients.
That's right.
And the idea is to unpack India's medical tourism sector that seems to be, well, really taking off.
It really is a global phenomenon.
So we're not just looking at that it's a major destination, but using this data, these experiences you share,
Yeah.
to figure out the real sort of quantifiable reasons why.
Exactly. And based on this crystal analysis and what patients are saying, it really boils down to a few key things working together.
Okay.
You've got the cost effectiveness, which is undeniable. Then there's the quality of care, high standards, good tech,
Right.
plus deep expertise in specific areas. And importantly, it's just become much more accessible.
All right, let's start with the big one then, the cost. That often grabs the headlines. How significant are the savings according to that CRISL data?
Well, the numbers are pretty striking.
Yeah.
The research suggests procedures in India can be anywhere from 60 to 80% cheaper
60 to 80%. Compared to where?
compared to what a patient might pay in the US, the UK, or Canada, for instance.
Wow.
And Crystal even gives a specific example, like open heart surgery, one of the really costly procedures. Getting that done in India can be just a fraction of the price elsewhere.
Yeah.
That kind of saving, it's a massive pull for people.
I'll say 60 to 80%. That's life-changing for some people. But, health isn't just about cost, is it?
Not at all.
The sources you sent also really emphasize the quality. How do they describe the standard of care over there?
Yeah, absolutely crucial point. Quality is paramount. The sources make it clear India isn't just competing on being cheap.
Right.
It's built a solid reputation for high-quality medical results.
So.
This means serious investment in advanced technology, state-of-the-art equipment, and critically, a really large pool of highly skilled doctors, surgeons, nurses. The Crystal report mentions international accreditations, too, which signals they're meeting global standards.
Okay, so good quality overall. Are there specific medical fields where India is particularly known for its expertise internationally?
Yes, the source material gets quite specific there. It highlights areas like cardiac surgery, orthopedics, oncology, cancer treatment, and also organ transplants.
Some complex procedures.
Exactly. Fields where Indian hospitals and specialists have really developed a strong international name, attracting patients who need that high level of experience, not just the lower cost.
Okay, so you've got this powerful mix, much more affordable, high quality, specific, top-level expertise. But even with all that, getting the treatment has to be feasible.
Right.
What do the sources, maybe especially the patient stories, say about actually accessing this care? The ease of it all.
This is where that accessibility factor really comes into play. It's crucial, especially if you're coming from a country with, say, long waiting lists in the national health system.
Like the UK or Canada.
Precisely. The sources mention shorter waiting times as a huge draw. Imagine facing months, maybe years, for a necessary procedure back home. Being able to schedule that same thing in India within weeks, that's a very powerful incentive.
Definitely speeds things up. Is it just about the medical wait times or other conveniences too?
It's the whole package, really. The sources talk about that. Things like relatively easy visa processes for medical travel, streamlined travel arrangements, often bundled by the hospitals or specialized agencies, comprehensive packages covering airport pickup, accommodation, even aftercare.
Ah, okay.
Basically, reducing the hassle factor of traveling abroad for something as serious as medical treatment.
That logistical support, that packaging, really does round out the appeal, doesn't it?
It makes a big difference.
The sources also briefly mentioned where patients are coming from and something about cultural factors.
They do touch on that. Cultural familiarity might play a small part, maybe for patients from nearby regions. But the main drivers really seem to be that core combination: cost, quality, and access. The big source regions mentioned are West Asia, Africa, South Asia. But importantly, the sources explicitly note more and more patients coming from the US, the UK, Canada.
Right, places where cost or waiting list can be real barriers at home.
Exactly.
Okay, so let's pull all these threads together then. Based on the CRISL data, the patient insights, what's the big picture? What does this tell us about why India's medical tourism sector is thriving?
Well, it tells us it's become a really sophisticated system. It effectively tackles some major global healthcare headaches.
Wait, cost and waits.
Yeah, high costs, long waiting times, and also the hunt for specialized skills. By offering care that's significantly cheaper, high quality, specialized, and then adding that improved accessibility and convenience on top, India's really carved out a leading position as a global healthcare option for international patients. It's a successful model.
A really compelling combination.
It is. And, thinking about this rise of medical tourism, not just in India, but other places too, it prompts a bigger question, maybe something for you, the listener, to mull over.
Oh.
As patients increasingly look across borders for healthcare that hits that sweet spot of cost, quality, and speed, what does this trend really mean for how we define access to care globally, and what kind of pressure does it put on healthcare systems everywhere to